Welcome, everybody. I am Dr. Jason Dean, and I wanted to get one of these videos out to you. It's been a little while, and I do these every single day. So I just want to keep giving you education on what these are, because we've done hundreds of them just in the last few months or so, and they give us such valuable feedback that more and more people want them. So I just need to educate more people on how to get your hands on this, but also find out how your body is doing. I'm talking about the MVX Plus test, or what we call the Metabolic Vulnerability Index test. This came out last year, actually, and we use it now across the board for usually people coming into the office for the first time. And I've seen so many times where regular blood work looks wonderful across the board, but yet they're still struggling and having a problem with these test scores. The MVX Plus comes back completely different than what the regular blood tests are showing, as well as other diagnostic tests as well. So let's dive in real quick, and make sure to look below. You'll see the link that you can get your MVX test is. It's drjasondean.com/MVX, drjasondean.com/MVX. And again, you'll see it scrolling along the bottom here, so you can check that out as you go as well. Now, this is just the first person I'm going to bring up for this video. And this gentleman, 67 years old. When I show you, now you're going to be alarmed as soon as I bring up the numbers because of what they look like. 67 years old. And wow, those markers are, let's just say, astronomical. But let me talk you through them. Now, the way this test, it says MVX Plus. And if you look to the far right, on the opposite side of the actual titles of Metabolic Vulnerability Index, GlycA, et cetera, you'll see reference interval. And the reference interval, they're not in bold. It just says reference interval, meaning those are the ranges that the LabCorp blood test, the actual ranges for the test itself. Now, those are fine. I do look at those. However, I'm also looking at numbers within my own reference range or reference interval. So those numbers are one. I want people in a different range, and I'll go through that as I go through this test. So this gentleman, 67-year-old male, not the best diet in the world, previously major congestive heart failure, hospital patient, et cetera, out of the hospital now, but struggling, and has sought out our office for care. Now, right off the bat, this test measures cardiovascular system, measures liver markers, so cardiovascular markers, liver markers, and some kidney markers. Right away, I see all of the markers are out of the lab reference range, much less mine, -3 of them. And I'm going to go through that in a second. So the top numbers are typically cardiovascular markers, and the bottom number typical liver. They cross over with each other, though. So let's just go through this. This is really not good, right? We are working with this person now, so I feel much more comfortable. We're at least going to move these numbers and improve the quality of life. It's only 67 years old. This should not be how they look. The top number is the Metabolic Vulnerability Index. That is that top score. That's a metabolism number. How well is your metabolism even working? His score is an 81. That is a very, very high score. It should go up to 100. Now, the reference interval is 63. So this is way out of that. This means this person, this heart is so bad that this person is actually on the edge of mortality. This puts him in well over the 50 percentile of mortality over the next 5 years, meaning we have to do some real quick work. Now, this person has been to the medical doctor. They're on some medications, which completely understandable in this situation. But 81, really bad. I mean, this person is kind of like on the edge. So we have to do fast work. And then there's still no guarantee, because obviously this is a body that's beat up over a period of time. Down below that, you see the inflammation vulnerability score of a 76, very high. That means massive inflammation, massive heart, massive cardiovascular inflammation. Again, really bad outside their reference interval. That metabolic number I want below 30. Inflammation I want below 30. So we're not even remotely close to the numbers I want, much less the reference interval of the lab. Down below that, the GlycA number is astronomical at 738. We want this under 300. This represents inflammation, but also systemic infection, parasites, bacteria, fungal, viral. Again, completely out of control. This is a heart case. We're doing very fast work as much as we possibly can to see if we can not only pull back from the ledge, but try to improve quality of life, which that's longer down the road. Down below that, you see a small HDL particle number, 8.4. That's very low. Again, a struggle. Small HDL particle is part of the immune system, also knocks out infection, also is a transmitter in the bloodstream. 8.4 is so low, very high toxicity. That's a toxicity marker. Again, really struggling. Cardiovascular system is under siege. Below that, metabolic malnutrition index. Simply, are they getting nutrition? Are they, like, when they eat food, whether you're eating crappy food or you're eating super healthy organic food, are they getting it? Are they digesting it? Are they absorbing it? Most people are not. This score is a 79, way off the charts. Not absorbing their nutrition, not repairing. If you're not absorbing, you can't repair, right? When I mean repair, I mean rest, digest, repair your own system. Below that, you see a citrate number. Now, this number is actually not in the black, but still way out of control, 2.56. These are liver numbers. That is a congested liver, okay? Now, it's not out of reference range yet. It's out of my reference range, but it's not out of theirs. Valine, leucine, isoleucine. These numbers are very low. You'll see the leucine. It says results verified by repeat testing. They repeated the testing over again to make sure they weren't getting an incorrect number. These are amino acids that build peptides to build proteins. Building proteins are repairing the body. This person is so backed up, so congested, so infected, so toxic that they're not even repairing. So no matter what, this person could be living on an organic farm, eating perfect, and their body's in such disarray that those amino acids they're not repairing their own body. Really, really rough, really bad. Again, this person is working with us to repair and improve these numbers as fast as we possibly can. Hopefully, we can make a difference for them. So that's just one. I'll be bringing more of these to you right down below. If you want to get yours, your MVX, you can get a consult along with a report from me and the MVX Plus test included. You can go to drjasondean.com/MVX, drjasondean.com/MVX. We'll put that link in the notes as well. And stay tuned for more of these. I want to bring more to you, show you, and help you improve your life. Thanks for joining me. I appreciate it.